Yeah, great, thanks. So the International Health Literacy Association was launched 3 years ago. We are present in more than 50 countries and mostly professionals working on improving health literacy of people and societies. And thank you for the invitation to join this discussion today. Health is not everything, but without health, everything is nothing, said by Schopenhauer. So knowing about health literacy is a key foundation for living good lives and for thriving. It's the capacity to make sound health decisions in the context of everyday life, at home, in the community, at work, in the healthcare system, the marketplace as consumer, and in the political arena. And I think we all know that here during the pandemic, we have been challenged really from a societal level. So with changing our whole structures of healthcare and dealing with the pandemic challenge, and asking people to take decisions in everyday life and making sound decisions, but really sound according to whom. So many of us working in public health and healthcare and prevention and health promotion, you know, we are busy trying to improve health for people. And what we usually focus on is, for example, the challenge of migration and the mix of cultural beliefs, trying to accommodate various perspectives of health. We are dealing with the burden of disease, especially chronic diseases and non-communicable diseases. We try to deal with the burden of mental health that is growing. We are looking at preventive measures here, making recommendations for people to tell them what is good for them, but also knowing very often they will not always follow what we hope they will do. We are trying also to embrace new technologies and incorporate this in our systems. We are looking at the new opportunities for personalized healthcare and public health genomics. We are looking into increasing the use of new technological devices in our care and prevention. We have also now been dealing with the overload of information, even called the infodemic, along with the pandemic. We also, in all this, try to, create conditions for people to have good and healthy lives where they can promote their own health. But when we ask people, persons, what they see as good health, and we know this from terminally ill patients, ask, when you think about your life, what really mattered to you? And often they would say family and the family bonding, and if family is fine, I'm fine. It's about having a good everyday life, having a good stable job, knowing that you have a good income. It's about having time for reflection, so prayers, room for spiritual habits. It's about thriving, developing your own potential. It's about friendships. It's about being able to take good care of yourself, really self-managing, not being dependent on healthcare and support from systems. And it's about being able to develop yourself, being authentic, being you, being accepted and being respected as the person you are. It's about dignity for them. And the question is, how good are we in matching, all our ambitions on what is the good life with what people think is a good life? And that is where health literacy can really be a catalyst for change. For a very long time, we've designed our welfare systems based on people being able to have the skills to adapt to the complexity of the systems. We throw people around, ask them to navigate really complex, fragmented healthcare systems, social systems, educational systems. Yet we see now that there is this trend building on well-being economies, building on health promotion, building on empowerment strategies that there is a demand for a change of approaches, so that systems, health systems, social systems are actually now being designed in a new way, in a new manner that is applicable to people's complexity. So it's a change. It's not either or. It's probably and that on one hand people need to know about their own health, being able to say when they need help, being able to know their rights but also obligations, and the same for the system. Then having a more, let's say, holistic approach to people's health and what matters to them. But what I've seen is that speaking to patients, one said, you know, I felt so stupid when I spoke to the doctor, but I know I'm not stupid. Another one last week said, encountering the health system is like it chews you up and spits you out. So for her, it was like a monster. On the other hand, luckily, we also hear quotes that say, you know, I felt they were there for me and my family. I really got the help needed. The health professionals are wonderful. So we have this spectrum of experience from people, one on the very extreme, the monster, and the other extreme, this herd dog, being a very servant system, really trying to help and support you and empower you. So how can we best strike that, you know, a better balance probably towards the herd dog? Health literacy is really about knowing your health, being able to find a proper healthcare information so that you're able to take decisions also in accordance with, you know, support of your general practitioner and healthcare staff or social support, and then being able to actually take that action that is needed. And it's important because we know from our research that those who have lower levels of health literacy are often more ill, more in need of health care, more mismanagement of medication. We often see it among elderly people, or that people are not joining vaccine programs, often being hospitalized. So it has a huge economic impact if we don't make that good match. We also know that it really has two components, and that has been mentioned also by colleagues today and also in the opening speech, that on one hand it's about people's skills and capacity, but it's also how we as a society enable people to take these decisions. And we know from countries that have embarked on the health literacy journey that they have developed health literacy action plans. And interestingly, there is also a great overlap with those countries that have joined the Wellbeing economy collaboration, such as Canada, Scotland, and New Zealand, Australia, but also some European countries. And we know that also the Danish authorities have now started to develop new strategies in this direction, which we can really encourage. My own work was very much inspired by the donut model, which was also mentioned by Michael Whitehead. The donut model was developed by Professor Rayward, and her illustration here is that in the inner part, the inner circle of the donut, it's about ensuring that we have the foundation for a good life: food, water, income, education, energy, a voice to speak up, good health and equality. On the other hand, based on climate, her model is very much on climate change. It's also about planetary health, that we don't overuse resources. And my wish, you know, my dream is that could we apply the donut model to health and social welfare, so that we on one hand ensure that everyone has the foundation for good health and well-being through these indicators, and on the other hand make sure that we don't overspend resources where it's not necessary. And we know from research that, for example, in UK, that health literacy account for 10 to 20% of the healthcare budget, just because there is this mismatch that people are not, they come too late to treatments or to preventive screenings, or they are not coming in a timely manner. Information is not given in a way that they understand. They overuse or underuse basically the system, so that the burden is prolonged or growing. And there are ways that we can better accommodate the match to save lives, to save time, and to save resources, the costs. So it's really also about looking at how we spend our scarce resources. For some time, it's been one-size-fits-all approach, and what really matters now is to listen to people's needs and the experts' recommendations, and create a better sustainable approach where we are really mindful about how we make sure that people get what they need when they need it, and really make the match here, and not trying to put a square into a circle box, because that costs too much effort. And it is really a political choice. That's what we see for those countries that have embarked on the agenda. It's from highest levels that there is a buy-in to invest in health literacy, so that it's not a system focusing on the burden of limited health literacy, but really a system developing the health literacy as an asset for better health. And it's also to ensure that we leave no one behind. So it's up to you now to continue the discussions today, to face this challenge that we have, but also hopefully be the change, be the people that can redesign the system, so that we have a system and a welfare system that builds on the dignity, not the monster approach, but the herd dog approach. Thank you for listening.